Hello, my name is Anna Miller, and I'm a professor of orthopedic surgery at Washington University in St. Louis. I'd like to thank the editors of JBJS for inviting us to do this commentary on our paper, The Effect of Social Deprivation on Fracture Healing and Patient-Reported Outcomes Following Intramedullary Nailing of Tibial Shaft Fractures. In our city of St. Louis, we have significant population disparities in healthcare and resources. My co-authors and I decided to embark on this study to evaluate how this specifically affects our trauma population and fracture care. For instance, we know that certain patient populations in our city have a significantly decreased life expectancy just based on where they live and their zip code. This can be related to the Area Deprivation Index, which is what we used in our paper to evaluate the social deprivation. And then we also looked at the patient-reported outcome scores and the RUS scores for tibia fracture healing in these patients. Our most significant finding was that patients in these most deprived areas have a significantly longer time to fracture healing, which was an unexpected outcome for us. We believe that the most important future direction is to figure out why these socially deprived patients also have slower fracture healing times. We also found that patients in these deprived areas trend toward worse patient-reported outcomes, and this needs further exploration in the future. I recently had the opportunity to sit down with Charles Court Brown, and we discussed his long-standing interest in social deprivation and trauma, including his study from 2007 showing that tibia fractures in socially deprived groups are more highly associated with amputations. Unfortunately, we have not seen significant progress toward improving these concerns since that time. We have a significant road ahead of us to help patients with equality and helping with opportunities, and I would just like to share a graphic that helps explain what we need to do to improve the care for our patients. Here you can see our historic approach to inequality versus equality. In this drawing, you can see that the tree is tilted over and one child is receiving more fruit than the other. So equality would mean giving both children the same size ladder so that they can both get closer access to the fruit. But you can see here that doesn't help the child on the right as they still cannot reach the tree. So more recently, we have discussed equity, where the two children get different height ladders to allow them better access to the tree to boost the child on the right to a higher level. Unfortunately, that doesn't solve the underlying problems that lead to this disparity in the beginning. So what we really need to be focusing on in the future is justice, which is straightening the tree so that both children can get equal access to the fruits on the tree. In the future, I hope that we can push more towards justice in healthcare and getting all of our patients the access to healthcare that they deserve. Thank you, and we hope you enjoy the article.